This is the cell, our cell. So this is the surface of the cell. This is the core of the cell, right? That's stuff you already know. So we're going to keep coming back to this picture as we explain this, right? So these are the antigens, these are the antibodies, and these are non-specific antibodies. So as far as the antigen goes, we're talking about infection, right? This is something that latches onto us and infects us. This is our body's response to the infection. And why are these non-specific? Because this is specific to hepatitis, right? They're responding to hepatitis. This is just responding to not liking something happening in the body, right? It's a non-specific immunoresponse. Okay, so core, HBC core. So we're talking about the virus is latching onto the core. Now, why would it does it latch onto the core first? No. First, the virus comes, latches onto the surface. And through time, through chronicity, it'll eventually reach the core, right? So whenever you see that something related to core, we know it's latched on here, and we know you've had it for quite some time. It doesn't happen right away. Surface means it just recently happened, right? Let's say you came across the contaminated blood in the needle stick, and the first thing we're looking for is there any hepatitis latched onto the surface of any of your cells. That lets us know it recently happened. It's very acute. And then E, we're not really going to discuss here, but just in case you see it on the test, I want you to know what it is. It just means reinfection. E and C mean the same thing. It's attached to the core. All right, so then we have the same antibodies responding to those antigens, C, S, and E. We're not going to talk about E. And then IgM and IgG. Okay, so the first thing I want you to really make note of is that if you've received the vaccination, you never had hepatitis, all the antigens should always be negative. There's absolutely no reason why you should have a positive antigen, right? So always look out for AG negative. Should always be negative because you've never come across the virus. So how did you get a positive antigen? Now, as far as antibodies go, that's essentially what we're giving you. We're giving you an attenuated or a dead vaccine, right? A dead virus, so that your body could produce antibodies against it. So you should see some type of positive antibody response, right? The question is, which one should be positive? The only one that will ever present positive is a surface antibody, because we're producing antibodies on the surface of the cell. We don't produce it for the core, right? So your core should be negative whenever you receive a vaccine. E, we're not discussing. S should be positive if you are immune. If let's say you haven't finished your hepatitis cycle, then you're not going to be immune yet. But if you have completed the cycle and you're presumably immune, then we can confirm that by simply looking at your HbS or hemoglobin S. Antibodies should be positive, right? No antigen should be positive with immune. And as far as IgM and IgG, remember, these guys are responding to infection. So this is an acute infection. IgM, I'll write it in, is an acute infection, where IgG is a chronic infection. You've had it for a while. Negative, both of them negative, because you've never gotten the infection. You've only gotten a vaccination. And right, so now let's jump into some examples here. I got a second pager for you. So we're just going to go through vaccinated. So you just received the vaccination. So the only question I want you to ask, or let's say the question is asking, this patient has received the vaccination. What should we expect to see? Right? And that's all we're asking here. So as we mentioned before, if you've been vaccinated, should you have an immune response, a non-specific immune response? No. So let me see if I can write and do this at the same time. So you should be negative for the non-specific immune responses, right? Negative. Now let's talk about the antigens. Should any of your antigens be positive if you've never actually contracted a virus? No. So antigens right away, negative. Antigen, negative. So all we're down to is we're looking for a positive antibody. Now, the question is, should it be a core? Let's go back to the previous picture, which I'm sure you already guessed it. Should it be positive core or positive surface? Remember, vaccinations only work on the surface of a cell. So when we're talking about a hemoglobin, the core, antibodies should also be negative, because that's not what the vaccination is targeting. So the only thing positive should be your surface antibody. That lets me know you received the vaccination and now you have an immunity to that specific virus, right? And here I've even taken the liberty of popping up a question here. And notice it says, which of the following profiles is consistent with having immunity because you were vaccinated? Right away, the only thing that should be positive is hemoglobin surface antibody. That's it. So in this case, it's giving us some examples. I'm looking at the antigens. I'm only going to go with the antigen that is negative, right? So hemoglobin surface antigen is negative, right? This is antigen positive. You're out, you're out. And this one is says core antibody is positive, but we already discussed. We said that the the vaccinations do not work on the core, so the core should be negative as well. So far it looks like the beginning of B is true, and then it says that the surface antibody is positive. Yes, you are now immune to a vaccine you were given. So B is the better answer choice, right? All right, so that covers vaccinations. If you have any questions on that one, let me know. I'm going to look up another question on infection, and then I'm going to talk to you about the acute versus immune infection in the next video. Thanks.